Hi there, this is Damien Deeb with Healthcare Triangle. Welcome to Week in Review, week number 29. December 3rd, 2020. Going to give you some headlines, then I'm going to pop into a part of a conversation I had with Jeffrey Becker. He's a senior healthcare analyst for Forrester. We just got to talking. It had been a while since the last time I was able to talk to Jeff. I just thought he had a great perspective on what's been happening with COVID-19, how it's impacted operations, technology, everything healthcare in general. So we were able to kind of catch up and talk a little bit about that. So I did mention, again, part one of two parts. So next week we'll get to part two as well. So stick around for that, and then I'll leave you on your way with a little bit of a clip of some music. I wasn't able to record any this week. Just going to snapshot from some that I had in the library, if you will, with some visions of COVID-19 as we approach the holidays. I hope everybody's safe. I appreciate, again, we're coming up not quite on a year, but we're getting pretty close. So let's get into the headlines. Vaccines. Okay, hot topic. We want one. Well, the UK is the first country to approve Pfizer's vaccine. So that is being distributed to people as we speak. CVS will administer vaccine to patients' homes and nursing homes in the U.S. once everything is cleared and the FDA starts to approve vaccines. Cuomo anticipates about 170,000 vaccine doses arriving in New York City by December 15th, pending there aren't any major delays in that timeline. So that's within 12 days from now, folks. So that's good news. Start to hit the U.S., especially in such a hot zone as New York City. On more news about the vaccines, in order for the public to gain confidence in any vaccines that are finally FDA approved over the next couple weeks here, former Presidents Obama, Bush, and Clinton have all noted and stated that they're happy to publicly take the vaccines just to make sure that the public can gain confidence in the vaccines, that they're safe and that they're effective. So good for those folks. At least there's some presidents making a positive impact on our COVID issue. So thanks. Here we go. Dr. Joseph Varone at United Memorial Medical Center has worked, well, it was 251 straight days as of last week. So that might be, I don't know, closer to 255 straight days to care for COVID-19 patients. He's concerned that people are not listening to warnings and not behaving safely as we get into the holiday season. And he thinks that maybe the next 6 to 10 weeks may be our worst as the holidays approach. It's getting colder, people are indoors, and with the holidays, people are becoming a little bit more lax with their social distancing. So not just getting together in larger groups, even though they know each other and they think they think it comes down to trust, per se, of where other people have been. I don't think that's it at all. I think you have to be very careful in who you spend time with. I think pretty much the rule of if you don't live with a person, mask up, limit your exposure by limiting your contact with larger groups of people, especially inside where the air is a little bit more stagnant. So those are things to think about. Dr. Robert R. Redfield, who is the director of the CDC, he's actually also warning that this winter may be, quote unquote, the most difficult time in public health history. Okay. And he also warns us not to travel for the holidays. Okay. So I know that people are emotional about this year, being able to spend time with loved ones and not being able to spend time with loved ones. Please, there's a link in the description. Click it. There's some ideas and reasons behind why these physicians and why these directors of CDC and other people that are caring for the communities of COVID-19 tend to think that we should limit our exposure by limiting the get-togethers around the holidays. It's not to be curmudgeons or have lack of spirit around the holidays. It's really just to be safe, and there's substantiated evidence, I think, in some of the science and that we have available to us in some of the links that I provided in the description. So please take a look, and please keep up the hard work and the diligence in being safe for you, your family, for the community, for everybody throughout the U.S. and throughout the world as we get through this pandemic. So to continue a little bit more on exposure and what that means, quarantining. There's argument back and forth. There's a lot of disinformation. There's a lot of different information to kind of cut through some of that cloudiness, if you will. I decided to publish here in the description and then also mention in these headlines CDC's recommendations on quarantine following potential exposure. This is up to the date. This is current as December 3rd, 2020. It's very simple and easy. There's a 14-day quarantine following potential exposure. Okay, so stay home, stay alone for 14 days. Don't come within contact with anybody if you've potentially been exposed. 14 days. Okay, 14 days in a row. Don't take any breaks in there. Stay alone, stay home, stay quarantined for 14 days. Okay. There's two exceptions to that they have started to release as of yesterday, December 2nd, 2020. The first one is those without symptoms can end quarantine after 7 days with a negative test for the virus. Okay. So if you're potentially exposed, it's been 7 days, and then you test and it comes back negative, then you can go ahead and end your quarantine. That's one option. The other alternative is those without symptoms can end quarantine after 10 days without a negative for the virus. So that means if you've potentially been exposed, after 10 days, if you have no symptoms, even if you have not been tested, then you might consider ending the quarantine. I personally would probably continue on for the additional 4 days as per the original 14-day quarantine requirement. Okay. All right. So there you have it. A little bit of clarity on that. Again, I hear different stories depending on who I talk to. That's what the CDC guidelines are as of December 3rd, 2020. Some more COVID facts. Symptoms can start to appear as early as 24 hours after exposure. That's as early as 24 hours exposure. Okay. Doesn't mean that just because it's been 24 hours, you've been potentially exposed, you don't have any symptoms, you can go back out there and hang out with people. That's not what that means, because the median incubation period is 5 days. So most people don't even start to get symptoms after they're potentially exposed for the first 5 days. Okay, so right there, that blows it out past 70 hours. Okay, so quarantining, that's very important. And then also 5 days isn't even enough, because symptoms can develop nearly 2 weeks after exposure. That's the reason for the 14-day quarantine. So you are not COVID-free after a possible exposure for up to 2 weeks after exposure. So please quarantine. Don't put other people at risk. Let's get into the stats. This week, world confirmed cases is up to 64.5 million, up almost 10 million from last week. 54.4 million cases, over 10 million, just from in a week and a half since the last time I stated the stats here. Recoveries were up to 41.5 million throughout the world, up from 35 million. And deaths, 1.49 million deaths around the world from COVID-19, up from 1.32 million week and a half. At the U.S. border. So U.S. confirmed cases were now up to 14 million, up from 11.1 million cases just a week and a half ago. It's a huge spike. Okay, so please continue to be careful, especially around the holidays. Deaths were up to 274,000, up from 246,000 deaths a week and a half ago. Please keep up the diligence. Thank you again for your commitment. Thank you again for your efforts. Thank you again for putting yourself and your families at risk. I can't thank you enough. Let's keep this going for another couple months here until we can get through this pandemic and the vaccines can be out, and hopefully we'll be in a different position come February or March. Needless to say, happy holidays. We're getting into it. I hope you all had a great Thanksgiving. I'm going to transition now to a conversation I had earlier this week with Jeffrey Becker, Senior Healthcare Analyst for Forrester. What a fun conversation. It's been a long time since I've been able to speak with Mr. Becker. He has a wealth of experience. I was on the road with him for years as we sold EHRs years ago. Prior to that, I think he had some good, solid military history in medical field in the military. So, you know, quite a servant throughout his time and throughout his career to the communities in the U.S. community throughout the world as well. So it was a pleasure to catch up with him. Aside from all those great kudos, he's just a really fun person to talk to, and he's got great perspectives and ideas. So here, let's have at it. Part 1 of 2 parts with Jeffrey Becker from Forrester. Jeffrey Becker, how you doing, man? It's been a bit. Good to see you.
I'm good. How are you doing?
Good. Hey, so, you know, I like to talk to folks who have been kind of keeping up on COVID-19 since it all started, and I can't even imagine anybody that would have a better seat to what's been going on in the past 10, 11 months than you have with just some of the research, some of the projects that you've been involved with. So I don't know. I don't even know where to start with you, but What do you think? And I'm interested in hearing from you. You're seeing it, when we talk about digital transformation, technology, how that plays into COVID-19, healthcare process in general. Where do we start, man?
Yeah, I mean, the reality of it is it's been a long 10 months, but I think we're only just at the tip of the iceberg where there's going to be a long tail of just optimizing these processes and these new technologies ahead of us. But I think that really to answer that question, where you start, you've got to go hop in the Wayback Machine and go back to, end of 2019 and take a quick snapshot of what did the world look like from a health IT standpoint? How well prepared and well armored were we to deal with something like COVID-19 in March 2020? There's lots of different studies. We have our own, of course, but generally what we found when we looked at sort of the state of digital health and digital front door leading into the pandemic was that there was about a 25% adoption of virtual services or virtual care services, so low adoption. Remote patient monitoring was pretty minimal, even lower in the teens. So coming into the March timeframe, you don't have technologies in place to have doctor-patient connectivity, care at a distance, virtual services, remote patient monitoring, none of the things that really became critical to our response in the April, May, June, July timeframe, they weren't there. It was outsiders that were delivering those kinds of services. It was Doctors on Demand and Amwell and MD Live and Teladoc, outside organizations, because virtual care didn't really pay the bills. It was reimbursed at a much lower rate. The EHR vendors weren't really doing a great job integrating those kinds of solutions into the core tech, either on the patient portal side or for the clinician in the EHR. So it was just not an easy implementation, that not really something that reimbursed well. So there wasn't much calling traditional healthcare organizations to implement and bring those systems up. Now you're March 12th, and you have months worth of in-person brick and mortar patient schedules, and we're all facing shelter in place orders. So what do you do? What do you do if you are the CIO or the CMO of a health system and you have months worth of in-person patient visits that you need to pivot to virtual visits if you can? Well, the first thing that they actually did was they poured through those schedules and they looked for any patient visits that they could just cancel or defer. The government helped. CMS mandated that we defer elective procedures. So you saw a lot of the elective procedures get deferred. You also saw a lot of the in-person office visits. If they weren't for something acute, they got deferred. And so what the reality on the ground was at that time frame was docs were buying up webcams, outfitting their laptops, figuring out ways to implement bare bones virtual care solutions. HHS passed HIPAA waivers so that me and you, we could do this over WebEx, Teams, Google Meet, anything. Didn't matter if there was any kind of security protocol in place at all. It was just an effort to get some audio video connectivity between the doctor and the patient. So that's really the beginning of the story that has been the last 10 months, was there was this whole hog rush to pivot that in-person schedule to something virtual and then put the pieces in place to support that care at a distance, because the offices were being closed and we really weren't able to deliver care. There's a really interesting stat here in Boston. I follow the Boston numbers more closely, but in February, 0.1% of Medicare visits were done virtually. This is a traditional primary care visit for the Medicare population, 0.1%. In April, 79%. It's the astronomical growth. But you're seeing that across the country. That is what the reality and the numbers of this kind of growth looks like. So it's been a wild ride ever since the March timeframe.
I was wondering how it seemed like it happened fast, because you and I, we've been talking about this stuff and trying to trying to pitch this to healthcare for the past 10 years, I would say, right?
Yep.
These types of technologies, these types of solutions, jumping through these hurdles, getting past some of the limitations in the legal matter. Um, I was wondering how it was able to happen so quickly. It was just at such a rate I've never seen in healthcare before. And like now that you mentioned, HHS coming out there and wiping clear any types of HIPAA regulations just to try to get something in place, like that makes a lot of sense because that's a lot of hurdles that we had to jump through for the past decade that now we're probably moved away and out of there. What's the cleanup effect from that now that people are going back through and now they have to put those safeguards into place that they've already started down these paths on?
Well, fair question, and I think it's not just the security that HHS waived. There were more barriers than just technical that prevented health systems from implementing telehealth. The biggest one was that it didn't make business sense. It doesn't make business sense to pivot a visit that reimburses 3 or 4x what a virtual visit does, and then invest in a solution that moves a higher paying service to a lower paying service.
Yeah.
It just doesn't make sense. It didn't make sense. And that's why I think you saw we could have overcome the technical hurdles years ago if it made good business sense to invest in this. It just didn't.
Great point.
But HHS also introduced payment parity. So they were reimbursing telehealth visits for the same rate as in-person visits. Now you have HIPAA waiver, payment parity, all of the non-technical issues that were preventing us from adopting this were gone. The cleanup is a whole nother side of the conversation because yes, the CIO is responsible for making sure that we get a more integrated and more seamless experience on the front end. That a patient right now, your patients will get a text message with a link to a Zoom meeting and they'll go log in there and then they'll wait in an empty room. And if the doctor's running 20 minutes late, they have no way of knowing that. They're just sitting in an empty virtual waiting room. It's not a clean patient experience. So the technology side, there's a long way to go to make sure that all of those point solutions we talked about are integrated together. There's a unified patient experience, and it integrates back to like the patient portal, the central hub of the patient's UX. On the provider side, making sure that they have a schedule and they can launch out and it'll be in the EHR so that as I'm talking to you, I can navigate through your chart, I can do some of the documentation, I can place orders, and it's a more integrated experience. For 2021, that's what the IT side of the house is going to be worried about. What the CFO and the CMO are going to need to address is investment or divestment decisions at the end of the pandemic. Do we even want to keep doing this? So Seema Verma has said many times that the genie is out of the bottle on telehealth. But all that we can ascertain that she means by that is that they're going to continue covering it as a benefit, but no one's made any conclusive decisions on payment parity. And that's important because the providers, the cleanup will be payer to provider negotiations to continue pushing the ball forward on how much we're actually getting reimbursed for these visits and justification for sustained use of telehealth when there isn't a pandemic in place.
Yeah, I'm interested to see how that's going to develop. Just don't even know how that's going to go, right? So I want to think that the parity will be in place and will continue, but who's to say at this point? I've seen crazier things in the past 7 years alone in healthcare, so I don't know. Awesome talking about this. I hope we could do this throughout the year because I think it's just going to be more and more rapid with new things that that will pop up in the next couple of months that we'll circle back, talk about that we weren't even thinking that would even be a point of conversation for this time frame. So again, thank you for doing this with me. I hope to do it again in the future. I always ask a hot seat question, put you on the spot a little bit. Do you mind? Are you ready for it?
Of course. What do you got?
All right. So one of my favorite questions to ask people is, if you had 30 minutes, you could spend time with anybody either throughout history or in current times. Who would you spend that 30 minutes with, and what would you do?
That's a good question. I think I'd go get hot dogs and a beer with Dave Chappelle. I think that many times he would have an interesting perspective, but I've always enjoyed his view on scenarios and situations, and I think that we're all trying to be better than who we've been, and he's pretty persistently carried a voice of integrity and being true to his value system. So I'd love to hear what he has to say. I'd love to hear what he has to say about our healthcare predicaments and how we can do better about working with underserved populations, and just pick his brain about my world. I think that would be a lot of fun.
Hey, that's a great one. David Chappelle, love him. So that's a good one. Love hot dogs too.
Yeah.
Hey man, always great catching up with you. Hopefully not too much time goes by until the next time. Hey, stay safe. Appreciate what you're doing, and we'll talk to you soon. All right.
All right, man. Thank you. Thanks for having me.
Yeah, absolutely. Thanks.
Yeah.
Another special thank you to Jeff for doing that video call with me. Hey, fascinating. I had a fun time. That's just part one. Okay, so there's second part will be out next week. So if you thought that was fun, that's nothing. Wait for part two. Come back next week, and we'll have more for you, along with the link by then for the full video call with Jeffrey Becker. So, hey, thanks again, Jeff. Thanks again, everybody else. Stay safe, stay invigorated, stay healthy, stay energetic. Hey, stay happy for the holidays, even in the social distancing time. So I'll leave you with some visions of COVID-19 as we get to the holidays and a little bit of music. Again, I wasn't able to record anything this week. Maybe next week I'll be back up and running. Thanks. Take care. See you next week.
Remember me, though I have to say goodbye. Remember me, but don't let it make you cry. For even if I'm far away, I hold you in my heart. I sing to you a secret song every night that we're apart. Remember me, where I have to travel for. Remember me, each time you hear a sad guitar. Know that I'm with you the only way that I can be, until you're in my arms again.